How to lower blood pressure. If a person's blood pressure is more than 130/80ths of a millimeter of mercury, they should reduce it. You can lower your blood pressure in a number of ways, including by adopting a healthy lifestyle, following a specific diet, or taking medication. A blood pressure of 120/80ths of a millimeter of mercury or slightly less is considered normal. A person is said to have elevated blood pressure if their reading is higher than this value. High blood pressure, often known as hypertension, is a condition that occurs when the blood pressure exceeds 130/80ths of a millimeter of mercury. A person may have high blood pressure for a number of reasons, including biological family history of high blood pressure or hereditary factors, being overweight or not exercising frequently, obese, frequently consume unhealthy meals, such as eating a lot of salt, alcohol use or a smoking habit, several conditions, including sleep apnea, diabetes, renal illness, and thyroid issues. Blood pressure can be managed or reduced by adopting a healthy lifestyle. To the doctor, the ailment must be treated first if hypertension is brought on by it. Some quick actions to help reduce blood pressure include the ones listed below. Obesity can cause hypertension and make the heart work harder. So, a great technique to control and lower blood pressure is by losing weight. You are encouraged to lose weight till you reach your desired weight if you are overweight or obese. Blood pressure can be lowered by consuming fewer saturated fat and cholesterol as well as wholesome meals such whole grains, fruits, vegetables, and low-fat dairy products. Many types of salt, including salt used in cooking, snacking, canned goods, and soft drinks, contain sodium. Blood pressure will rise if there is too much salt in the body. Therefore, it is advised that those who have hypertension limit their intake of salty foods or adopt a low-salt diet. Please be aware that people should only eat 1500 to 2000 mg of sodium per day. Exercise that is performed 3 to 5 times a week for a duration of 30 to 60 minutes is advised to lower blood pressure. Exercise can reduce blood pressure by 5 to 8 millimeters of mercury when done frequently and consistently. Walking, running, cycling, gymnastics, and other forms of exercise are effective ways to reduce blood pressure. Stress that lasts too long or occurs too frequently can also raise blood pressure. You are therefore advised to manage your stress so that your high blood pressure can decrease. By relaxing, practicing yoga, meditating, or engaging in activities you enjoy, you can manage your stress. One of the most typical reasons of high blood pressure is these two unhealthy habits. Smokers are reported to be more susceptible to heart disease and stroke as a result of hypertension issues. Antihypertensive medications are frequently required to lower elevated blood pressure, especially if, after more than 6 months, the aforementioned techniques have not reduced blood pressure. However, this medication should only be used under a doctor's prescription and not at random. Your doctor will modify the type and dosage of your antihypertensive medicine based on your age, how your body reacts to the medication, and any previous medical conditions you may have had.